Lingu and Dawai are very effective points. Means whenever you are starting the master Tung acupuncture practice, so just these 2 points will bring you the confidence. So we are starting from the place where we left yesterday. So let's see this palm. And our points are Lingu and Dawai, or 22.04 and 22.05. So this is the palmar surface, but our point is not on the palmar surface. These points are on the dorsal surface, on the back side. So you can look your arm. When you look your arm, so make it 2 lines from the thumb. This is the line. In this thumb line, you continue this line like this. And if you see very clearly, you will find one crease here. So we have to locate 2 points in this crease. So first point will be 1 chun away from this junction. Second point will be 2 chun away. So this is the point, it's just opposite to Lingu, because on the back side we have Lingu. So if from this part we straight, if we go to chun, how to go to chun? We can measure with the help of 3 fingers. We can measure with the help of 3 fingers. So from this point, if we are going to chun, so this is the point which is just opposite to Lingu, or we are telling this point 22.02, which we will discuss later on. For right now, my focus to tell you, just I want to tell you this point. If we insert the needle from here toward the Lingu, then this point is working for the severe sciatica pain. Just I did today. Today one female patient came and she was complaining that she was having sciatica pain which is referring down in the leg, in this root. She was having pain in the right side. This is the incidence of today. So I put this point, Lingu point, but from the opposite side. So here. From here, I inserted one needle here. She got immediate relief within 6 seconds. So this point is very effective point Lingu, but from the opposite side. The number of Lingu is 22.05, but when we are putting from the opposite side, the number of this point is 22.02, which we are going to discuss later on, because right now our topic is Lingu. So either you put the Lingu from here from this side, or you can put the lingu from the opposite side. It is working for the sciatica pain. It is working for the sciatica pain of opposite side. Always remember, for opposite side, not for the same side. So this is the importance of lingu. Sometime one day, what happened? One lady came to my clinic with a complaint of sciatica pain, and I told her, okay, you have to come for 12 sittings minimum. So she told me, okay, can doctor you demonstrate one point so I can experience that how much pain is there. Okay, so I thought, okay, I will put only one point, and I thought in my mind, I will put lingu point because lingu point will also bring some good effect, and she will be happy. I inserted only one needle in the lingu. Then she went to the home and told me, doctor, I am not feeling any pain, which I was feeling earlier. So she came after 7 days. Then I asked her, why did you not come to for the treatment? She told, doctor, no pain at all. Lingu point. I have tried this lingu point for many patients. This point is very much effective for lower back pain for many patients. Only single point. If we combine with few more points, it becomes more effective. Because I'm also doing lots of experiments. Sometimes what I have seen that I am putting the lingu point and few more points, then effect will be good. But I am putting the lingu point. So this is the first case where I am putting the lingu point and few more points, then effect will be good. But sometimes I have seen that I have put the lingu point and few more points near the palm, and also few more points in the feet, in the ear, in the scalp, because my mind is wondering, oh, this is also very good for sciatica pain and lower back pain. Put this point also. Oh, this one is also very good. Put this point. I put 22 needles. No result. No results. I'm surprised many times. So always try to select few points as per your diagnosis and make a good protocol, but do not try to put the all ear points like 8 point in the ear, 6 point in the scalp, TCM 10 points, Master Tung 8 points, and making the 30 needle protocol and thinking now you have done a very good job. Then patient will tell doctor, no effect. I have done these all experiments and I've seen, oh, then what happened? One day I was treating one patient. I put some mastering points for the lower back pain, and it was these 2 points, lingu and dava. I did not put any other points. That's it. Patient told doctor, I'm feeling much better. Great. Then patient came for next sitting. Then I put lingu dava. I put 15 more points with the thought, oh, now, today I will do miracle. Then patient told doctor, no effect. Then I thought, how it is possible? Then I again, oh, wait, I will put more points. Then I again put more points after removing the odd needles. No effect. Okay, wait. Then I put more, I put few more points, no effect. Don't do this. This is a very great mistake. Because once you insert the needle, the energy circuit is going on in the body for 72 hours. So sometime it happened that you have inserted lots of needle and patient told no effect. There may be two reasons. Number one, you have did the right treatment, but effect may come maybe next day. Sometime it is happening. Second, you have put 15 needle, maybe they have cancelled the effect of each other, many of them. And your main point has been cancelled by some other needle. But energy circuit is going on in the body. So if you want to give the next sitting, so at least you give after 6 hours. I was treating one slip disc patient and I put lots of points, 20, 25 points. No effect. Oh, I was surprised because that 20 points, if I may make a batch of that 20 points, like out of that 20 points, if I am putting 4 points to anyone, he's telling I'm feeling much better. But I combine 4 different protocols. Then patient will no effect. Then again you try and putting more needle, then it will not affect the patient. So kindly wait, if possible, for 1 day or minimum 6 hours. Then you apply second sitting. And you can tell the patients, now whatever you have done, that energy circuit is going on in the body. So you will get the effect after some time. So best thing, start with a few points and make a perfect diagnosis earlier and start your treatment with a very effective points. And in the starting, do not put the point which is painful. You may start with some points which are painless. Then in the next sittings or after 2 days, you can choose some points which is little sensitive, like when we are putting the points. Some points may be little painful, where we are having no muscles, no fat. But wherever we are having good muscles, good fat, that point may not be that much painful. But master treatment is so effective, even you are creating little pain, effect will be very faster. So the lingo is here. Dava is here. If you put both points together, so they can treat each and every problem in the body. Especially L4, disc degeneration. Now I will tell you very special treatment for if some person, few days back, one lady came to me, my clinic, for the treatment of pain in all 4 extremities. Means she was having pain in both arms and both legs. So all the 4 extremities. Were painful. So first I applied some point, some other point in first sitting. The next day, her husband came. Doctor, she was crying a lot. She got very little benefit and she was crying a lot whole the night. So kindly do something. Okay, then I applied different treatment. Then what I did, because in the master Tung acupuncture, it has been told that if you do this treatment, This is the leg area. This is the knee. If we divide from the center, so this is the yang side and this is yin side. So yang side is the stomach meridian and yin side is the spleen meridian. So this whole side has been considered as a stomach meridian. This whole side has been considered as a stomach meridian. Now, take this whole stomach side. If you do something here in the stomach zone, we are telling it stomach zone. So it is affecting whole stomach meridian. Now, what is the stomach meridian? Let's see here stomach meridian. Stomach meridian is starting from the eyes, then crossing the chest region, lung region, heart region, then going down, 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 and reaching to the knee. So right now my focus is that it is going through the lung. So we have two meridian, one in the right side, one in the left side. So stomach meridian is going through the lung. So whenever you want to do something better with the lung, so we are treating stomach meridian. You want to work on the lung, you treat the stomach meridian. As per the acupuncture, skin also comes under the lung. So if you want to treat the lung or you want to treat the skin, you have to treat the stomach meridian. Lung means metal. Lung means dryness energy. Lungs and large intestine coming in the metal and dryness energy. So whenever we want to treat the lung, so we have to treat this stomach meridian. So we will learn many points for they are very good for the skin disorders. They will be on the stomach meridian only because stomach meridian passing through the lungs. So finally, what I want to tell you, this area has been told lung zone. The name of this area is lung zone. If you do something here, it will affect positively our lung. So if someone is coming to you with a monkey itching, he is itching the skin like a monkey. You can treat here in the lung zone because lung is connected with the stomach. If someone is suffering with any lung disorder, you can treat here this lung zone. So, number two, if someone is suffering with a pain in four extremities, so Master Tung told, first you reduce the dryness. How do you reduce the dryness? Take out few drops of blood from this zone, from anywhere from this area. Just take a needle, which we are using for the injection, and see if you can see some blood vessels, blue color veins, puncture that blood vessels, take out few drops of blood. So this is called blood letting from lung zone, because Master Tung by using bloodletting for minimum 30% patient. So as soon as you bloodlet from this area or lung zone, this bloodletting is very good for skin, lung, and reducing the dryness. So now, what is the treatment? If someone is suffering with a pain in the four extremities, so prick blood from the lung area, and after that you add lingu dava. This is the very excellent treatment for the pain which is happening in all the four extremities. Means if someone is telling you, I have both hands, both arm pain, both legs pain. One lady came to my clinic. I asked, okay, tell me which leg is paining? Right, both. I said, okay, tell me which is more? No, 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 both are equal. Even my both arm is paining. So in that condition, we are doing the bloodletting from lung zone. So bloodletting from lung zone and adding the lingu dava. Now, if you tell, some of you tell, oh, I can't take out the blood, then take a comb and do the scraping in this area, in this direction, in upper direction. Take a comb and do the scraping in this area in the upper direction. That is the that also bring the effect of sedation. In the acupuncture, we are doing gua sha. That is like rubbing with some rough surface. But in the absence of that gua sha, you can use a comb. So the effect of bloodletting you can create with the combing. You can do 5 minutes. Then after 2 days, you can repeat it. So this will be the, just we have to put 2 point only, lingodavai, but taking out the blood from the lung area, lung zone. So this become very effective treatment for the pain happening in the four extremities. Yesterday we already discussed that lingodavai combination is very effective for high blood pressure. So we can use both the point for the patient suffering with high BP. So this is also very good for the high BP. Pain in four extremities. And sciatica pain, which is the main indication, and L4, disc degeneration, and any problem happening anywhere in the body, the combination of lingodavai is making a complete circuit. With the help of this complete circuit, we can treat any things happening anywhere in the body. Remember, we have to put this point opposite side. So either there is a migraine headache, facial paralysis, someone suffering with a deafness or tinnitus, paralysis, hemiplegia. If someone is suffering with a paralysis or a hemiplegia, so we are doing many other points, but we are also adding lingodavai. So we are using lingodavai for multiple problems, but they are more effective if some problem happening in the upper part, like headache, migraine, tinnitus, deafness, and in the lower part, like reproductive problem and lower back pain. So this was the completion of Lingodavai. Let's proceed now. So as per the, when we look at our arm, so let's see our arm. So when we are looking the arm, we can see here we are having 5 fingers. So index finger, middle finger, ring finger, small finger. We are having 5 fingers. And one is thumb. So if we do our hand like this, look at my hand. If we do our hand like this, you can see my hands and both the thumb in between, like this. So this is becoming like a brain, like a small finger representing the back part of the brain, ring finger representing the temple region, middle finger representing the vertex head, and this index finger representing the frontal head, and thumb who's in between. They are the connectivity of right and left brain, which is corpus callosum. So what I want to tell you here, if we take our 2 hands, so we can look at here, we are having 4 fingers. In one hand, this is a thumb. And also we are having 4 fingers in the other hand. Oh, sorry. So if we make so this is a thumb, index finger, middle finger, ring finger, and a small finger. We can also make other hand like this. So suppose these are the 2 hands. So this is the right hand, this is the left hand. So if we unite both the hands together like this, so this is the front part. This is the back part of the brain. Because as per the imagination concept, our arm is representing full body. So this arm is representing full body. So finger become the brain. So when finger become the brain and we imagine both hands together is a body. So we are uniting both the hands together like this and thumb in between. So in this condition, we have 4 fingers And in the brain also we have 4 lobes. If we look at the brain, in the brain we are having 4 lobes. This is the frontal lobe. This is the parietal lobe. On the side above the ear, this is the temporal lobe. And on the back side, this is the occipital lobe. So look at here. One side we have 4 lobes. Let's see on the right side. So on the right side we have this frontal lobe. Then right side we have temporal lobe, parietal lobe. Right side we have temporal lobe, and right side we have occipital lobe. Same we have other side. So if we compare these 4 lobes with our forefinger, and we are uniting our both the finger. So frontal lobe is represented by index finger. Parietal lobe is represented by middle finger, because this parietal bone is going till the vertex of head. This temporal bone above the ear is represented by ring finger. And back side, this is the occipital lobe, which is on the back side, represented by a small finger. So these are in the sequence: index finger, middle finger, ring finger, and a small finger. So if someone is suffering with a headache in this frontal part, someone is complaining, I have frontal headache, we can do the treatment with the help of index finger. If someone is complaining that having headache in the parietal lobe, this lobe, or in the vertex, top of the head, so we can treat with the middle finger. If someone is complaining that I am having migraine headache above the ear, then we can take it. We can treat it with the ring finger. And some other person complaining that having headache in the occipital lobe in the back side of the head, here. So we can treat it with the help of a small finger. Once again, I will tell you, this headache can be treated with the help of index finger. The vertex headache, top of the head, vertex headache can be treated with the help of middle finger. The headache on the side, just above the ear, migraine headache, from the third finger or ring finger. And occipital headache can be treated with the help of a small finger. So in the human hands, we can see we are having 5 fingers here. So this finger can treat the frontal headache, this finger can treat the parietal and vertex headache, this finger can treat the temporal headache on the side of the ear, and this finger can treat the occipital headache. On the back side of the head. So let's see the other image. So now if some patient coming to us with a complaint of headache, so how can treat the patient? So look at this image. So first I am going to tell you the treatment of frontal headache. So look at the index finger here. In the index finger, we know this is the junction of yin and yang, the black and white skin, and we have 3 joints here. lower joint, middle joint, and upper joint. So if we choose the middle joint, just putting one needle here on this point can treat the frontal headache. Because we are working on the frontal lobe with the help of index finger. So we have to insert only one needle here. Now, the second patient coming to you with the complaint of headache on the vertex. So we'll choose the second finger. So this is the middle finger, which can treat the vertex headache or parietal headache or headache in the top of the head. So this is the junction of black and white skin or yin yang. The three joint, 1, 2, and 3. Just this one point can treat the parietal headache or headache in the vertex. So we are putting the needle here. Now, person is coming to you with the complaint of headache on the temple area or temporal headache. So now we are going to the ring finger. So this is the ring finger now. And on this side, this is the junction of black and white skin. We are having 3 joint here. So we are choosing the point in the middle joint. So this is the point which is very useful for the temple headache. Then finally, we are coming to the small finger. In the small finger, this is the junction of yin and yang, black and white skin. We are having 3 joint here. In the center, we are putting only one needle. That is effective for the occipital headache. So these 4 needles are called 4 TOUS points, TOUS, which is the very famous point of the master in acupuncture. Those who are practicing, they know this point. So we are having just 4 points here. 1 here on this side, 2nd here, 3rd here, 4th here. The question comes, why this can treat the frontal headache? So I told you, as per the imagination, this part belongs to the head region and finger are representing the 4 lobes of the brain. So as per 4 lobes, this is the frontal lobe. This is the parietal lobe. This is the temporal. And this one is occipital. So this is the concept. So this is the 4 lobe theory, means the 4 finger of the brain is representing the 4 lobes of the brain. And thumb is the junction between right and left brain, or we are telling corpus callosum, which is the connectivity of the right and left brain. So this is the concept number 1. Concept number 2. If you see as per the meridian wise, so in the index finger, we are having large intestine meridian. Large intestine meridian going in the front side of the face, front side of the head. So it is treating the frontal headache. Then if you want to see the direction of large intestine meridian, then you can see in this image. You can see this large intestine meridian going to the frontal region. Shortly, means tomorrow when we will discuss the Dr. 10 balance method. Then we will learn it. The large intestine and stomach both are interconnected. So whenever we are treating the large intestine, it is also affecting the stomach. This will come in the 10 balance method tomorrow. So whenever you are stimulating the point in the large intestine, it is also affecting the stomach. And if we see the root of the stomach, this is this root. And stomach meridian also going to the head region, we can see here. So ultimately, this is index finger covering the frontal part of the brain. So this is covering the frontal headache. In this way, the very clear understanding will develop after learning the 10 balance method. Then we'll see these points scientifically, why this point can treat the frontal headache, why this point can treat the parietal headache. In this finger, we have pericardium meridian, which is connected with the liver. And when we talk about the vortex or parietal lobe is connected with the liver. So if some patient is telling you, I have headache in the top of head, middle of head, vertex head. Because when anyone coming to you with a complaint of headache, we are asking, tell me the location. It is in the front side? No. Back side? No. Lateral side? No. Only top of head. It is a clear sign of liver problem. This is the liver headache. So we have to treat the liver. And this is also diagnosis. The person having some problem with the liver chi. So with the help of middle finger, we are stimulating the pericardium, which is the connectivity of liver. So liver and pericardium both we can treat with the help of middle finger. Then we are coming to the ring finger. In the ring finger, we are having triple Borba meridian. If we see the root of triple Borba meridian, it is going around the ear. So look at this image. If you look at the triple Borba meridian, you can see this is covering the ear area, around the ear. And triple Borba meridian also connected with the gallbladder. So whenever you treat the triple Borba meridian, it is also affecting the gallbladder. And when you see the root of gallbladder meridian, it is in the temple area. So ring finger is treating the headache happening in the temple area. In the same way, if we go at the last, these are small finger. A small finger is connected with the meridian. Which meridian is going to the small finger? That is small intestine. If you see the root of the small intestine, whether it is connected with the back or not. So small intestine and urinary bladder, both are very deeply interconnected. So when we are stimulating the small intestine, so it is affecting the urinary bladder meridian, which is clearing the headache on the back part of the head. So these are understanding we will develop after learning the Dr. 10 balance method, which we are starting tomorrow. But right now, only I want to tell you these things, just by putting these 4 points. 1 needle here, second needle here, third needle here, and fourth needle here. If you put these 4 points, you can treat any headache and effect will start within 5 to 10 minutes. So let's see one practical demonstration. One more thing, we have to put this point only in the left side. Either this is the headache on the right side or this is the headache on the left side. You have to put the point only in the left side because we are moving the chi Okay, so now see the practical demonstration of this point. So these are the mass starting point for headache. If we see our whole arm, this is representing full body. This is the head and neck. This is the chest region. This is the umbilical. This is the abdomen region and reproductive part. This is the reproductive part. So when we see the forefinger, they are representing four lobes of the brain. So we can do the imagination like this in this way. So when we are doing the imagination, this index finger showing the frontal lobe, middle finger parietal lobe, ring finger is temporal lobe, and small finger showing the occipital lobe. So with the help of these four lobes, and the in between thumb is connecting all the four lobes of the right and left side with each other. That is working like the corpus callosum of the brain, which is the connectivity between both side lobes. So this is the index finger, middle finger, ring finger, and small finger are capable to treat the pain happening anywhere in the body. Now see the practical demonstration. So we are inserting the needle on the yin-yang junction or black and white skin junction. So first we are treating in the index finger. So just we are putting needle here like this. This much insertion is enough. We are inserting the needle only two fan. And this is in the middle finger in this way. Now this will be in the ring finger, then in the small finger. So we have inserted this four needle in the left arm, either this pain in the right side or left side. So in Master Tung acupuncture, if we do inverse imagination, so this is our full body. So this is head, this is neck, this is chest, this is umbilical region, this is abdomen, and this is reproductive part. So we are coming back to our head region. If we talk about, we do like this. We are uniting forefinger, thumb in between. So it is like that. So the front, both the index finger representing our frontal brain. This is parietal brain represented by middle finger, temporal brain by ring finger, and occipital part, small finger. And both thumb representing the junction between right and left brain, corpus callosum. So this is brain. Okay, this is brain. So when anyone is suffering with migraine headache, if it is in frontal side, so we have to treat index finger for parietal, middle finger, temporal, ring finger, and occipital, pinky finger. So we are putting the 4 points for all the 4 parts of the brain. So first we will put the needle between middle interphalangeal joint. So this is the junctions of white skin and black skin. In this junction, like towards the thumb side, we will put one needle. This will cure frontal headache, only single needle. Same directions for the middle finger for parietal headache or vertex headache. This is second point. This is the temporal headache. On the ring finger toward the pinky finger side, we will put one needle. This is for occipital headache. So with the help of these 4 needles, we can cure any types of headache. So we can use sometime what happened. Patient is confused. He is telling that doctor, I am having frontal headache, but after some time he's complaining that I have headache on the temporal side. So we have seen this types of cases. But if you are sure, like I have got one patient who told that I am having only occipital headache. I put only one needle in the small finger. It will work. It's enough. And it is enough. But if some patient is suffering with a mix like frontal headache, a frontal headache may go little till the ear, then it will become temporal. If it is going little up, it becomes parietal headache or vertex headache. So that time it becomes sometimes difficult. Then we are using all the 4 needle. But you are allowed to put only single needle if you are sure in your diagnosis. Okay. So this was the completion and this was the 4 toes point. Yeah, you're right. So in the index finger and in the middle finger, we have chosen line A. Yes, you're right. And in the ring finger and the small finger, we have taken the line E. That is right. Absolutely right. So good. So can we proceed now? Fine. Okay. So now we'll proceed. So we are coming to the lines. We are discussing about the lines. So let's discuss about the points on the line. In our arm, we can see this is our palm. Okay. So let's see the thumb here. Now, if we see the thumb from the upper side, this is the G line. G. Because we started A line will be this side. Then B, C will be in the palmar surface here. So let's make all the line. So this is the line A. Then this is the center line is C. Then this side, this line, this will be the E. So A, C, and E. Then we will turn on the back side. Now we are turning. So we have seen this is the line E just on the side. And in the center, this is the line G. So in between, we are having this line F. We are discussing about the F line, which is very important line, F line. So it is starting on the level of this nail, F line. So remember the F line, this F line is toward the index finger. It is not opposite side. So when it is toward the index finger, we are telling, what we are telling? Ulnar side, which we discussed, ulnar side, because this side is radial side. So how I will define the line F, I can tell from the G line, if I go ulnar side, so between the G and E line, I have F line. Okay, let's see this F line in other image. So look at this image. In this image, we can see the thumb here. In this image, we can see just bone. And I want to show you just bone. That's why I'm showing this image. Because when we make the complete finger, we are also having little muscle and skin here at this, till this level. So suppose this is the complete thumb. This is the complete thumb. Now, this is the border of bone. And even after the border of bone, we have little part on the both sides. Some part this side and some part this side. So when we are talking about the lines, this is the center line, which we are telling G line, and our F line is just here. This is the F line. I'm showing with the blue color. This F line just adjacent to the bone, just on the border of the bone, F line. But when we are going on the side, this other line. So I want to show you the exact location of the F line. That's why I'm showing this image. So if we see this image, without this drawing, then you can see if I make the direct F line here, so this is the F line, just on adjacent to the bone. Now I'm coming to the other image. In this image, this is the border of bone, and this is the F line. So this is the F, G, H, and this side is the E line. So forget all other line, just remember F line right now. So we can see here, this is a knuckle of thumb, and this is the F line. And this is the first joint. So we are not doing anything here, and we are not going down. We have to just focus in this middle area. In this middle area, we are drawing 2 points at equal distance. The name of this point is 11.24. 11.24, or we are telling them Fouquet. The name of this point is Fouquet. Or these points are called gynecological point. We are inserting the needle. When we are inserting the needle, we are inserting just on the adjacent to the bone. Because when we talk about the reproductive part, as per the 5-element cycle, the water element is connected with the reproductive part, and which is also connected with the kidney and urinary bladder. And kidney is also connected with the bones. So if anything happened wrong with the reproductive part or bones, we have to treat the kidney. So kidney and reproductive part and bones, they are having very close relationship. So whenever we want to treat the reproductive part, we have to be very near to kidney. So we have to very near to the bones. So whenever we are putting the point here, we are trying to put the needle just touching adjacent to the bone. So we are pinching the skin and putting the needle. So in the next session, I will demonstrate these points. So this is the point 11.24 or Fouquet. This point is very effective for all the female reproductive problem. Either this is painful menstruation, dysmenorrhea, excessive menstruation, or menorrhagia. This point are very effective for the ovarian cyst. This point is very effective for the ovarian cyst, and as well as anything which is happening in reproductive part, in female reproductive system. One lady came to my clinic with a complaint of cyst in the right breast. I inserted this Fouquet point in the left hand. After 20 minutes, just after 20 minutes, cyst becomes soft, and she was feeling that it has reduced near about 30%. It was normal cyst, but when it is cancerous or malignant cyst, that condition is totally different. I'm not talking about that. I am talking about normal, benign cyst. This Fouquet point is very effective for all the female reproductive problems. Earlier, we were using only spleen 6. As per the experience, it has been seen that whatever spleen 6 is doing, like some patient some one female patient is having lots of pain in the reproductive area because of abortion. She just gone through with the abortion and having lots of pain. If we insert the spleen 6 point, she will feel good for 15 minutes. But if we insert the 11.24 point with one couple point, then she will feel good for 5 hours. That much difference. So this 11.24 has been proven is a very effective point for all the female reproductive problem. This is very famous point with the name of Fouquet. Whenever we are putting the 11.24 point, we always put this point opposite side. But if you are not sure that which side is affected, because if female is telling you that having pain in the right breast, then you can put in the opposite side. Or cyst in the right ovary, then you can put the opposite side. But many times it is difficult to know. So one day we are putting in the right side, and another day we are putting in the left side. So if you are clear, then she is suffering with one side problem, then you always can put this point in the opposite side. So this is Fouquet or 11.24. So whenever we are putting the Fouquet point, so remember this thing, that Fouquet point is available in the line F between MCP joint and distal phalangeal joint. Let's see here again in this image. So this is the distal joint, and this is the proximal, this is the MCP joint, metacarpophalangeal joint. In between we are drawing the F line and drawing a 2 point at equal distance. So this is Fouquet. So let's see here. This is the Fouquet. Whenever we are putting this 11.24 point for any female reproductive problem, so we are putting one more point, opposite side. So this Fouquet become multiple time more effective. So where we are putting the Fouquet point in the one hand and one couple point, that is 11.06 in the other hand. So the combination of 11.24 or Fouquet and the 11.06 are very famous, and it is called the female gynecological treatment. This Fouquet point only useful for the female. We are not using Fouquet point for the male. But 11.06 we are using for both male and female. So if any female is suffering with any reproductive problem, we are using both the points. But if any male suffering with any reproductive problem, we are using only 11.06, which we'll discuss tomorrow. So only 1 minute, I will demonstrate you the Fouquet point. So look at the thumb here. And you can see this is the F line, because this is the A line. A line will be this side. And when we are turning the thumb in this way, this will be the F line. So this is the F line. So when we want to put the needle in the Fouquet point, we are taking this distance from this area to this area. 1 minute only. Yeah, clear now. So we can see here, this is the knuckle. This is the knuckle of thumb. And this is the distal joint. In between, only in this much area, we are taking 2 points at equal distance. So look at the thumb. So whenever we are putting the needle, so first we are searching 2 points at equal distance. So this is the, so we can see here, this is just adjacent to the bone. This is the point number 1. You can see here. So we are putting needle from up to down, means we are not putting needle from up to down. We are not putting needle like this. This is the wrong. We are putting needle in this way, in this direction. And also we are putting the second needle in this way. So you can see here, we are putting the 2 needle like this. We have to insert little more, but I am inserting for myself. So you can see here, this is the location of. So we have to needle from up to down, adjacent to the bone. So this is the Fouquet point. Needle should be up to down. And we can insert needle in this way, just adjacent to the bone. This point is very effective for all the female reproductive problems. Maybe, I don't know, you are still, you got or not. Have you seen, able to see? Yeah. In this way, you can see this. So we have to put the point just adjacent to the bone. The question comes, how much needle should we have to put? Only 2 fan. You know how much 2 fan means? 1 chun means 1 thumb width. So if we talk about the depth, so this 1 thumb, this is called 1 chun. Divide this in 10 parts. So that is called, means 1 chun is equal to 10 fan. So we have to insert only 2 fan, means not 1 chun, just 2 fan. The 20% part of the 1 chun. So little insertion is also enough. So this Fouquet point is very effective. But whenever we are inserting the Fouquet point, we are using Fouquet point in the one hand, that is 11.24, and 11.06 in the other hand. So if we are putting this point in the right side, then 11.06 point we are putting in the left side. This becomes very good treatment for all the gynecological problems. We are also doing the combination with other points. So we will see the combination of this Fouquet tomorrow. So tomorrow we will start our class with the Fouquet. So enough for today. Thank you so much. Any question? I have shown only 2 points, and these 2 points together called 11.24. So 11.24 is the 2-point unit. One another point, that is 11.06, I will show you tomorrow. So if I put Fouquet point in the left hand, I have to put the 11.06 point in the other hand. So means tomorrow is Sunday, so our class will be on Monday. Tomorrow we have two other classes. Tomorrow we have Dr. Tan balance method and Visoma acupuncture. Because many people have requested since longer time, they want to learn Visoma. So we are doing tomorrow, okay? These 11.24 points are very much effective for irregular menstruation and polycystic ovary. Very effective. There is not a single point in the body is that much effective like Fuke for all the reproductive problems. We will discuss more about the Fuke tomorrow. We will start our session. We will do the bloodletting at the last. Bloodletting part will come after finishing all the points. Day by day treatment, sir, means what is the meaning of Raja Bapuji this? See, for demonstration purpose, I inserted Fuke for myself, and I'm feeling too much energetic now. Something happened. I don't know. This point is very effective. Yes, this point, Fuke point, is useful for all the problems, including amenorrhea. Okay, I will give you a list. Yes, tomorrow. So you will be, because you're asking the problem, because I told all the menstrual problem, but maybe you're thinking for this problem or that problem not. So dysmenorrhea, amenorrhea, metrorrhagia, polycystic ovary, and all problem this is affected, each and every reproductive problem. After abortion, if some female suffering with the pain, someone having painful menstruation, all the problem. It is very effective for excessive bleeding. We are telling, yeah, it is very effective for excessive bleeding. So we are using 11.24 on the one hand and 11.06 in the other hand, and we are making the combination. 11.24 point will be opposite side if we know the problem. Okay, like some female having ovarian cyst and having pain in the right knee. So we can assume maybe right ovarian cyst in the right side, but may not be there. So we are putting the 11.24 in the other side. But we are changing the side because if this point is working in the opposite side, we have to insert the needle for minimum 30 minutes. 30-40 minutes is a good time. We cannot do the treatment every 6 hours. Master Tung acupuncture is very much effective. If you give the treatment today, patient will be very happy. Tomorrow, he will be very happy. But you are doing continuously after a few days, he will be unhappy. Because excessive treatment given by the master tool will consume more energy. So break is required, compulsory break is required. So you do the 3 treatment, then you do alternately. That is a good approach.